Okay, so hi, I am Leanne McNall. I am going to be doing a pocket guide for the future practice as a pediatric nurse practitioner because that's the track I'm in at Regis College. And this is for our advanced health promotion and disease prevention class at Regis. So this is just my title page. And then this is actually my table of contents. So I'm just going to go through this kind of quickly, but basically section 1, I decided to open up with what I call the meat and potatoes of pediatrics. So there is a bunch of guidelines for nutrition starting with ages 2 and then all the way into adolescence, talking about how many calories they should have per day, what food groups they need to focus on. And obviously it changes as, as kids grow up and they get their brain development, and then continuing on going through puberty and adolescence. And then I also decided to put in feeding your child within the first year because I think that is something that's super difficult. So we'll go over that. And then section 2 is going over what vaccinations you can and cannot get during pregnancy. And then also the validity of the MMR vaccine and basically, because there was a bunch of articles that were posted about how it could cause autism. So talking about that for parents, and then also why you should vaccinate your child. So I have a lot of education on that. Section 3 is the expectations of an amniocentesis. So why we might want to do an amniocentesis and what parents can expect to see in the results of the amniocentesis. And then also there's some breastfeeding guides, and then there is also education on newborn care. Then section 4 is a handout on the HPV vaccine, and then also a self breast examination, which because I think that's super important to teach adolescents so that they know that into their adulthood. And then section 5 is all the vaccination schedules. So starting from 0 and then into young adulthood. And then also I have some mood and feeling questionnaires for adolescents in there. And then also a PD screening checklist. So it's a psychosocial like a psychosocial evaluation for kids, all ages. And then section 7 is going to be the brown bag review, which is just kind of a way to do medicine reconciliation. And then I have the beers list and the kids list. And those two things are basically highlighting, they're highlighting potentially adverse drugs for the elderly and then for PD population. So I thought that was important. And lastly, 7 is just a bunch of PD assessment tools. So we'll go over those. So for section 1, I have nutrition guidelines. It starts all the way from 2 and then into adulthood. But basically this is from the CDC, and it takes every one of the food groups. So it goes through dairy, vegetables, fruit, protein, and then it puts how many calories they should be having, because I think sometimes parents, they might get stuck on one food group or another. So it really is just kind of like a general guide of how much their kids should really be getting. And then it has some exercise guides in here too. This guide is just talking about how to feed your child in the first year of life. So when to start putting cereal in, when to start, should I still be breastfeeding the whole year through? If you are bottle feeding, how does that look? If you're doing supplementation, if you're doing both, like when should you start, adding some vegetables and fruits to their diet? And then this one is a complete development milestones from ages 2 to 5. It's very thick, but it's great because it gives a checklist for the parents, and they can go through and not feel like they're not doing the right thing, or they're not following up on where their child should be in their development. So it's 2 months through 5 years. So I thought that was really great. This is also something from the CDC. And then for section 2, this talks about vaccinations that pregnant women can get during pregnancy, like right after postpartum and even before getting pregnant. So during pregnancy, we want to make sure they're not getting any live viruses. So it talks about that, and then why they should be getting the flu vaccine and things like that. This talks about, this is a document for, it's an advocacy group called Voices for Vaccines, and it talks about herd immunity. It talks about why we should vaccinate kids. Sometimes I think that parents don't want to do anything that are going to harm their children. So if I can give them something that has value to it and, is backed up by science to say, hey, this is what's going to happen if your kid gets vaccinated, this is what it does for the rest of the population, I think that they might be a little more open to vaccination. And then this is what I was talking about. So this is a guide that has about 12 published articles, and they're in a bunch of medical journals that basically debunks the MMR vaccine giving autism or causing autism in kids. So that's a huge thing, and I think it's still affecting the PD population now, even though it happened years ago. So that's what that is. And then this is my next section. This is talking about what to expect in amniocentesis. So what to expect in amniocentesis, and the before and after, and then when they should expect the results for genetic screening. This talks about safe sleep. That's a huge priority for me in my future practice, to make sure we're teaching safe sleep now when kiddos are born, so that parents understand that. And then there's a little checklist that goes with it, which I think is great. This is breastfeeding versus formula. So from what I learned, and even from in class, best is fed. We want kids to be fed, but this kind of talks about why it's good to breastfeed and why it's good, what the versus formula, and how formula can be really great for some kids. So this talks about this just to make parents feel comfortable, like they're actually doing the right thing if they can't breastfeed for some reason, or vice versa. And then this is just from Medela, which is like a breast pump company, and these are some of the breast positions that I could show them. And then this also is more, and this just shows about how to get the nipple correctly into the mouth so the baby is actually getting milk. And then this is also talking about self-expression of milk, so that way if they need to supplement and the baby's not getting enough because they're not eating enough, this kind of shows moms how to do that. And then for my next section, this is kind of a shorter section. This is the HPV vaccine handout, which is lovely. It talks about why I should get it, how HPV is spread. So I thought that was really great and colorful. And then there's resources on the back that parents can also go to look to check for prevention of cervical cancer. And then this is cool. This is just a self-breast examination. So I really would like to, start teaching that in adolescence, so they can continue that into their adulthood. And I just really liked the graphics on this. And then this is just the recommended PD schedule for vaccinations. It's very dense, but I really like the color coding in here. And then I also have, this is a symptom checklist. So this is a psychosocial evaluation. It's for kids of all ages. It's a parent reported, and then there's also a self-report. So depending on how old the child is, we'd have them self-report, but also there's a parent report checklist, which I think is really helpful. This is a mood and feeling. So this is a way to ask kids to screen for suicide and depression without being too invasive and kind of scaring them. So I thought that was great. And then this is just this is just for adulthood vaccination. So I have that, and so that I have it for moms who may be pregnant. And then second to last, this is the brown bag medication review. So this just talks about how we can be better about medicine reconciliation, and how to take steps with your patients. This is this is the kids list. So this is what I found after investing a little bit into the beers list. Basically, it's just saying, you know, this is all of the harmful drugs that could be potentially harmful. This is what we need to be aware of in our practice, which I thought was really great. And then I did put the beers list because I think that they're really similar. I know this is only for the elderly population, but I still feel like I should know this in my practice. As you know, there are grandparents and other elderly people around, so I thought that that was good, and it also mimics the PD population. And then lastly, this is the NPAS, which is the neonatal pain assessment tool, which is really great because they can't talk to us, right? So this is a really great assessment tool, and I used it in my preceptorship. This is the RAPS, which is the behavior risk analysis for adolescents. If we think that there might be some behavioral issues, we can use this form. And then this is just a clinical guideline that I got from, there's like a development childhood psychology article based online that I used, and they tell you all of the assessment tools that you can use from kids, you know, as early as toddlers all the way into adolescents, and they just tell you where to find them, which I thought was very helpful. So this is my pocket guide, and thanks for listening.